Angina pectoris, a term that may sound like a distant constellation in the night sky, is actually a medical condition right here on Earth. It's a type of chest pain caused by reduced blood flow to the heart. Imagine, if you will, your heart as a demanding organ, always asking for more oxygen. When the heart doesn't get enough oxygen, it sends out a distress signal, and that signal is the pain of angina pectoris. Transitioning to the subject of diagnosis, it's essential to grasp that angina pectoris isn't a condition that can be pinpointed with a mere cursory look or a rudimentary medical checkup. To detect if there's a lack of blood supply, doctors frequently employ an electrocardiogram, often known by its abbreviation ECG. An ECG is a medical test that uncovers heart issues by gauging the electrical activity generated by the heart in its contraction and relaxation phases. This activity is represented in distinct waves: the P wave, the QRS complex, and the T wave. To break it down, the P wave signifies the electrical impulse traveling through the atria, essentially the upper chambers of the heart. Following that is the QRS complex, which represents the electrical impulse making its way through the ventricles, or the lower chambers. Lastly, the T wave captures the moment when the ventricles are returning to their restful state. This intricate process can be better understood by looking at an ECG graph. As we point to the specific waves on the graph, you can see the heart's electrical activity come to life, providing vital information about the heart's health. In addition, there are scenarios where a stress test may be required. Here, the heart is monitored while you partake in physical activity, or after you've been administered medicine that puts your heart to work, akin to the exertion experienced during exercise. Before we delve into the diagnostic methods, it's important to understand that there are different types of angina pectoris. These variations are primarily distinguished by their symptoms and triggers, and they play a crucial role in shaping the course of treatment. Firstly, we have stable angina, the most common type. This typically occurs when the heart is working harder than usual, during physical activity or emotional distress. It follows a regular pattern and can be predicted to happen over months or even years. Next, we have unstable angina. Unlike stable angina, this type doesn't follow a pattern and can occur even when you're at rest. It's unpredictable and may signal a worsening heart disease or an impending heart attack. Variant angina, or Prinzmetal's angina, is a rare type caused by a spasm in the coronary arteries. The pain is usually severe and occurs while at rest, often in repetitive cycles. Lastly, we have nocturnal angina. As the name suggests, this occurs at night while the person is sleeping. Understanding these different types of angina can help doctors determine the best course of treatment. In the next scene, we'll explore additional diagnostic methods that can provide a more comprehensive understanding of the heart's condition, aiding in the confirmation of angina pectoris. Stay tuned. In addition to ECG and stress tests, there are other diagnostic methods that can be utilized to detect angina pectoris. These methods provide a more comprehensive understanding of the heart's condition and help in confirming the presence of angina pectoris. Firstly, a CT scan, or computed tomography scan, can be employed. It provides detailed images of the heart and its blood vessels, helping to identify any blockages or abnormalities that might be causing the chest pain. Next, we have the MRI, or magnetic resonance imaging. This imaging technique creates detailed images of the heart and its structures, assisting in the identification of any damage or disease that could be affecting the heart's functionality. Lastly, blood tests can be conducted to identify any biochemical markers that indicate heart damage or disease. These tests can detect levels of certain fats, cholesterol, sugar, and proteins in your blood. High levels can indicate a risk factor that could lead to angina pectoris. In conclusion, these additional diagnostic methods, while more time-consuming and sometimes requiring specialized equipment, provide a more comprehensive understanding of the heart's condition and the presence of angina pectoris. They serve as vital tools in the hands of medical professionals, assisting them in making a more accurate diagnosis and, as a result, a more effective treatment plan. One might wonder what causes this condition. The answer lies in the lipoproteins, which are the molecules responsible for transporting cholesterol and triglycerides in the bloodstream. The low-density lipoprotein, or LDL, often tagged as the bad cholesterol, can form plaque in the heart's arteries, reducing the blood flow. On the other hand, high-density lipoprotein, or HDL, the good cholesterol, helps to remove LDL from the arteries. Very low-density lipoprotein, VLDL, and chylomicrons also play a role in this complex dynamic. When we talk about the treatment aim for angina pectoris, the main goals are to reduce the frequency and severity of symptoms, to improve quality of life, and to prevent a heart attack and death. It's like trying to keep a teetering tower from falling over by carefully removing and adding blocks. When it comes to the drugs used to treat angina pectoris, there's a vast pharmaceutical arsenal at our disposal. Organic nitrates like nitroglycerin widen the blood vessels, allowing more blood to flow to the heart muscle. Calcium channel blockers reduce the heart's workload by relaxing the blood vessels and increasing the supply of blood and oxygen to the heart. Potassium channel openers, another group of drugs, cause the blood vessels to widen, increasing blood and oxygen supply to the heart muscle. In addition to these, other medications like statins, dipyridamole, and oxyfenbutazone can also be used to manage angina pectoris. Statins help lower the level of LDL cholesterol in the body. Dipyridamole is a blood thinner that reduces the chances of blood clots, and oxyfenbutazone is a non-steroidal anti-inflammatory drug used to relieve pain. However, like all drugs, these too come with their share of side effects. Organic nitrates might cause headaches, dizziness, and flushing. Calcium channel blockers can cause tiredness, rash, and unusually slow heartbeat. Potassium channel openers can lead to flushing, dizziness, and palpitations. The side effects of statins include muscle pain and damage, liver damage, and increased blood sugar levels. In conclusion, angina pectoris is a serious medical condition that requires careful diagnosis and appropriate treatment. Understanding the role of lipoproteins in causing this condition, as well as the various treatment options and their possible side effects, is crucial. Remember, knowledge is power, and the more we understand about conditions like angina pectoris, the better equipped we are to manage them. Now that we've come to the end of our discussion on angina pectoris, we would like to remind you of the importance of spreading awareness about this condition. If you found this video helpful, please do not hesitate to like, share, and subscribe to our channel. Also, we encourage you to leave your comments below. Your feedback is valuable to us. It helps us improve and provide more informative content. Remember, by sharing knowledge, we can help each other lead healthier lives. Thank you for watching.